Hi, I'm Dr. Aarti, consultant dermatologist, CI Cosmetic Clinic, Bangalore. So, dark circles are very common in Indians. So, every other person has a dark patch under the eyes. So, whereas all the dark circles are not the same, so there are various causes that a person ends up having the dark patch beneath the eyes. So one is hereditary. The second most common thing is allergies. If you are an atopic, if you prone to allergies, you sneeze a lot, you rub your eyes very often, then you will end up having a dark patch surrounding your eyes with all those fine lines beneath your eyes. And if you don't sleep adequately, you have a lot of stress going around, that's when your eyes become really tired and gives you that sunken look. In old people, the causes for dark circles can be because of the lax skin above their eyes. So the eyelids, it lags and it gives you a shadow effect, and eye bags which occur underneath your eye can again give you a shadow effect and looks like you have a dark patch around your eyes and makes your eyes very tired and sunken. So not all dark circles are the same. So if you see different people with dark circle, one might have a very dark patch under their eyes with lot of skin markings, and other few will have dilated veins beneath their eyes which gives them a very bluish tinge to their eyes. Few might have swelling beneath the eyes called the eye bags, and for few there might be a depression in this area which creates an hollow effect and which makes the eyes look very tired and sunken. So the treatment aspect also differs according to the type of dark circle you have. So not one treatment goes well with everyone. So depending upon the reasons I told you, your treatment can vary between applying a depigmenting cream for the pigmented patches, or undergoing a chemical peel to get rid of the pigment, or you can undergo Botox for the fine lines which I mentioned before. And if you're going to have something called as tear trough, which is very common in Indians, like the depression under the eyes, then you need something called as fillers or fat transfer to restore the lost volume. So people who are crash dieting, who lose a lot of weight, they'll tend to lose fat in this compartment and their eyes goes inside. It gives you a depression in this area. So it's actually the shadow effect which makes your eyes look very dull and sunken. So in such people, fillers or fat transfer will give them a very good results. So in few people who are really obese, you can see the pigmented patch extending from the cheek to the eyes. So in those sort of people, they usually have something called as metabolic syndrome, and if they get that corrected along with weight loss and all the depigmenting creams, they can see a very good results. So since the skin under the eye is a very sensitive area, I would suggest please don't go for any home remedies around your eyes, because once it gets sensitized and once the skin around that area is damaged, it's very difficult for us to restore the normal texture. So always take your expert opinion, and always remember that the treatment changes according to what type of dark circle you have. For you, it can be just a dark circle, but a doctor, a dermatologist always knows to differentiate and will be helping you in getting the right treatment for you. So meanwhile, what you can do to prevent or the aggravation of dark circles is a little bit of lifestyle modification, like a brisk walking, or a mild exercise if you are really obese. Drink a lot of water. The wrinkles and the dry skin under your eyes is because you are dehydrated. So drink a lot of water. Use a sunscreen before you step out in the sun. So that will again help in reducing the pigmentation, or if you a person who's undergoing any treatment for dark circles, it helps in preventing the complication and making things worse.